Thank you, Dr. Garibo. And I'd like to take this opportunity to thank Dr. Dewan, my fellow board of directors, and those who toil in anonymity behind the scenes to make all of this possible. Sandra Vamos comes to mind, and Michelle Byers, and without them, this would not all be possible. This is the largest conference of its kind on the East Coast, and we're very proud of that. To that end, I'm going to speak a little bit, and I'm going to present some statistics that are dark and depressing, so I risk spoiling your festive moods, or worse yet, your appetites. But I would advise you, if I could give one piece of advice, is your attitude is a choice. You can choose negativity and bring everyone down around you and risk losing staff in an era where we can't afford to lose staff because there isn't any. Or you can find it within yourself to be a clinical leader and find the silver lining and be positive. And in that way, your employees will go to bat for you, you won't lose them. So if I could just emphasize that. I have no disclosures. So Houston, we have a bit of a problem here. We have declining reimbursement, downward regulatory pressure. We don't have enough staff, there's inflation, and so we're kind of dealing with a perfect storm at this point. As we all know, a lot of the guidelines have changed. There's a downward push for volumes in this country at this point. We're on the radar of CMS. The new epidural guidelines that came out in December of 21, a little less than a year ago, were far more draconian than many people think. They specifically state that you can do 4 blocks in a year. The reality is you can really do 3. The injections have to last for at least 3 months. So you can't really do it on a 3rd month. You're doing it in the 4th or the 5th month, so it's really 3.